Alrighty guys, my name is Miguel, giving you your daily dose of radiation. In today's video, we are covering holding patients for the beloved X-ray exam. So some of those patients out there, maybe because they're babies, maybe because their mom is pregnant and they can't hold, or maybe because it's a difficult patient, various different aspects of why you as X-ray tech would have to hold the patient and acquire some exposure. Which, once again, you wear your lead. Always wear your lead, especially if you're going to be holding patients or dealing with any situation of radiation, because at the end of the day, yes, at that moment you do not feel the radiation, of course, but over time, I imagine it as throughout your career, depending how long you do it, every single dose is like a tiny little hair thin, and especially for your thyroid. And over a long time, if you don't wear your protection, it can cause vital damage, which majority of the times we don't see until towards the end of your career, especially someone like me who works a lot of overtime. Like, I would say probably 2 times, almost 3 times the amount of any of the techs that I work up here. So I try to make sure that I follow my Alara protocols and make sure I try not to hold as much, try not to minimize exposure to myself and the dose and everything, because I know that on the long run, regardless of how much you try to be safe, there's always a small dose. And especially in America, here in America, we have big patients. Big patients means more dose of radiations to acquire better image, meaning more scatter, aka Compton scatter. If you know, you know. So try to keep safe out there. I know it's not always easy. Majority of the times we end up having the patient. Occasionally you can have a nurse hold. Sometimes they don't mind holding because they're not involved so much. But other times they don't like to. So if you can have the parent to hold, even better. If you have to hold, please let up and keep yourself safe. I know majority of the times I've noticed that a lot of the veteran techs, they start to, like, if they're shooting portable, they start going less and less farther away for the exposure, or they will raw dog and not wear anything and just shoot it type of deal. So occasionally the doctors will order stuff and it almost gets to the point to where you feel bad, where you're like, if this patient don't care about their exam, why am I here having to let up and hold and go above and beyond if this patient doesn't? Sometimes it'll be like people will come in and they'll order maybe a foot, and the patient will be drunk, or the patient will have whatever's going on and they don't really care, and you're just trying to get the image for the doctor, and you're like, why am I doing this? I can see why you would feel the type of way. At the end of the day, we're just here to get the best images, and I know sometimes that it gets frustrating, especially when you're shooting babies and it's a 2 view. Certain doctors would be notorious for 2 views, and especially in the NICU and stuff like that, when you're shooting babies a lot. Sometimes we shoot little kids in the NICUs a lot of times, because there's central lines or whatever they have going on. And then sometimes you feel bad. You're like, bro, I just shot this kid 8 times because you can't figure out how to place your tube. And I know they're like, oh, well, this is important for the vital, but at some point you as a tech feel bad, because you know the amount of dose of radiation, especially so small. And they'll order baby grams, which baby grams, you have their whole body exposed. And I know it is technically a small dose, but if you think about it, if they get that much and then throughout their whole life, whatever awaits, you do kind of feel bad. Mainly with the babies, it's kind of your guilt trip. Everyone else is kind of not as much bad with that. But I will say that out of all the fields of radiation, X-ray is the least of the doses. Now, if you're holding in CAT scan, that's where it gets a little bit more dangerous. Over there, you're pumping way more radiation. Over there, holding someone for it, that's where you gotta be careful. Anything that and the gammas and the ultra and the nuclear, that's where it gets dangerous. I can say that probably when we hold maybe an X-ray in a lifetime, if you would do that in other fields that are higher radiation, you're probably going to be in trouble with your dosimeter, so you got to be careful on that. Majority of the times, the only techs I see that get back stuff from their dosimeter from the board are people who work in fluoro a lot and people who hold a lot of patients a lot of times. Then they'll get letters saying, hey, you reach your allowance of radiation, or hey, be careful, you're like really high on your dosage you get. That's kind of where I notice where it happens. I work a lot, like 3 times as much as any other tech at my hospital, and I've not gotten anything. I just try to make sure I stay my distance, try not to hold as much, and try to be safe out here, because I know that when you're young, you just want to make money and you're willing to do what it takes, but sometimes you also have to think about the future and in the long run to see how future Miguel or future whoever you are will keep you safe, because the main thing is the thyroid, because that affects a lot of things in your body, and that's the main thing that I know if you're young, your reproductive organs are also important, but your thyroid is important for like the other aspects of life. So stay safe out there, and see you on the next one.